Hi, everybody. Good afternoon, trustee members and Mental Health and Recovery Services Board staff, as well as um, colleagues working in the area. Thank you all for letting me join virtually. I really appreciate it today specifically, but lots of stuff on our agenda, so it's great that I can join virtually to have this conversation. Um, Myself, Jim Gunther, and Lynette Hare, our executive director, who I believe is in the virtual audience watching as well. We met after receiving the initial email, and we really wanted to thank you all for considering our recommendations and solutions and allowing us to be a part of the conversation for the upcoming fiscal year budget. After meetings, we had determined that some of the possible solutions that we feel we may be able to enact, we had two. So specifically, we could reduce the number of contracted HAP subsidies by working with LMH. That work with LMH would be to obtain more project-based vouchers, more PVV vouchers for our incoming applications. This would require LMH to adjust or lower their approval criteria for their applications. However, some of that work is being done and that ongoing conversation with LMH is happening. So that was a potential in which we could reduce potential spending by transitioning to LMH project-based vouchers. We could also continue to look at our adult care facility program spending and reevaluate how that program is spending its dollars. That's been ongoing conversation with the board, staff, so we would be willing to additionally look at that program and discuss that budget and how the spending is happening there. Again, those were the two solutions that we really felt could make a difference or could assist in this process. And we really just wanted to thank you all for your willingness to include us in this process, as we know it's not an easy discussion. So we hope that conversation, that feedback, we could continue to provide quality services to the community. I did also turn in these comments in writing to Faith earlier this afternoon, so you do have that in writing as well.
Thank you, Alex. Alex answered one of the questions that we suggested providers, contract agencies respond to is what do you think your organization could do, or what do you think the board should do in relation to working to reduce their expenses by $950,000 next year? So those are some of the comments that Alex presented forward. We appreciate those comments. It's certainly things that are on our thought process as well as we, hey, Commissioner, as we move forward with the discussions. So I'm going to switch gears and ask Mr. Adam Nutt to come up and have a few make comments. Do we want to use this, right? Yep.
Good afternoon. You guys hear me okay on the microphone? All right. So thank you for having me today. As Scott said, my name is Adam Nutt. I'm the Chief Financial Officer at ZEF Center, and I'm speaking today on behalf of our Executive Leadership Committee, which is headed by Deb Flores, our Chief Executive Officer, who could not be here today. And again, I want to thank you for the opportunity. We really have had very good working relations with Scott and the rest of the board staff in furthering our mission. And I want to talk a little bit about that. ZEF Center is a behavioral health provider in Toledo in the Northwest Ohio area. And this year, we will be celebrating our 50th anniversary. Being in business for 50 years is quite an accomplishment. Being a nonprofit in behavioral health for 50 years was a mission. At ZEF Center, our mission is creating hope and recovery through integrated person-centered services. When Elizabeth ZEF founded ZEF Center in 1974, The agency was primarily concerned with post-psychiatric hospitalization treatment of residents in the South Catchment area of Lucas County. There were 11 employees. Today, Zeph Center has over 450 employees who are the lifeblood of our organization. While that growth may seem remarkable, we are down from the over 600 employees in 2018 during the height of the pilot program known as Health Home. And since that time, we, like you, have faced many challenges and have had to make many difficult decisions in order to survive and to sustain the organization. Finances have been the biggest challenge, not only to Zeph Center, but to nonprofit organizations across the area, Ohio and the United States. According to a recent survey by Statista, the largest challenge facing nonprofits is rising operating costs. How many times did I hear Scott talk about rising operating costs for you all? A close second and third in that survey is limited staff capacity and difficulty recruiting and retaining quality staff, which are the biggest expense for the organization. In order to face those challenges, Zeph Center's vision is to be the leader in behavioral health and substance use in the Toledo area. And when faced with those challenges, being asked to provide creative ideas to cut nearly $1 million from your budget is difficult to accept. In normal business, supply and demand dictates revenue, staffing, and growth. In nonprofit, supply and demand are typically converse to growth. We are seeing a greater demand for services, not less. We are seeing increases in people seeking services for gambling treatment, crisis services, housing, and mental health, not to mention the battle against drug addiction, specifically overdoses stemming from fentanyl being used to enhance the potency of various street drugs. The battle is far from over, and some are predicting this crisis will be worse than the opioid epidemic. You may also be aware that in 2023, Ohio voted to legalize recreational marijuana. What challenges lay on the horizon? Specifically, we have seen new patient intake numbers increase to over 3,600 per year. And in that time alone, we have fielded 47,000 phone calls to our crisis helpline. The demand is real. I have only a minute, so I'm going to skip over a little bit here. Today, our ask is not for you to spare all or part of our funding, but to instead join us in changing the conversation in our community, to increase advocacy for funding, to bust the stigma of mental health and addiction, and use data to show the results. Results that would take far more than 3 minutes we each have today. I'm delighted to hear you all as board members, when I come to the meetings, talk about your personal and professional experiences with Zeph Center. It shows that the work that we are doing is quality and it's making a difference. And it shows that the resources you are giving to Zeph Center and the community are being used wisely and responsibly. We are committed, no matter the decision you make, to the community, to our mission, and to hold ourselves to that high bar of performance. Thank you for the opportunity today.
Thanks, Adam. That's why we also collect these things in writing, so the things that you weren't able to get to, we'll make sure that they make it into our summary. Appreciate it very much. Are there any questions or any response? Thank you.
Lot to think about.
Which is customary around today, is we have a commissioner that has joined our group. We want to introduce to you all our newest commissioner, Anita Lopez. And we always, as customary, we always ask electeds that join us to just stand up and say a few words if you so desire.
Thank you. Go there.
Well, what about the last 2 years, right? A lot of ideas and thoughts, and I just want you to know one of the reasons why I decided to run for county commissioner was, instead of being someone on the sideline, being critical and maybe not understanding what more I could do, I realized I wanted to be part of the solution and helping, making sure we're earmarking dollars and growing those dollars to help expand services. So I'm taking a pay cut from the auditor's office, but my heart is in the right place. I feel like I'm going back home when I was that social worker at Adelante, working and trying to make a difference in individuals' lives. A lot of the things I think I learned from Jack Ford, working at Sassy and underneath him as the mayor, is going to help me serve in filling, I think, the same areas that Tina had served in. I told Pete Gerken I feel like I'm coming back home, where my heart's really at is helping the community in all the areas that Mr. McNutt has said that Zeph has provided. But that is where my priority as a county commissioner is social services, substance abuse, mental health, children's services, all those organizations that are related to each other, that all overlap with each other. So if there's anything I can do, obviously I'm 100% behind the levy. Everything I can do to hand out literature and make sure we renew that, and when necessary ask for an increase. We recognize, again, as Mr. McNutt said, that with the legalization of marijuana, just like the legalization of gambling in Ohio, that is going to present greater challenges. So whatever I can do, not whatever I can do, what I will do to help you be successful and partner with you in any way. And it's sort of nice now being able to not look at it of where all the dollars are going from. I understand completely taxpayers' concerns about increase in property taxes, but I also recognize that our community, our Lucas County citizens, are very generous for the right causes. And this is a cause that is near and dear to many lives that have been impacted in Lucas County. So I think we're going to have a successful levy campaign, and I look forward to celebrating in November. Thanks.
Thank you, Commissioner. How about if we switch over to Ms. Tava Scott, representing New Concepts. Hi, Tava.
Hello, Scott. How are you?
Great. Glad you could join us today. The floor is yours.
And I just want to mirror Alex's sentiment in saying I wanted to express appreciation for allowing me to present virtually today. As you all know, I'm speaking on behalf of Janice Edwards and the New Concepts executive team, and I'll keep it brief. First, we want to just really express our sincere gratitude for the long-standing support that we've received from the Mental Health and Recovery Services Board. We just truly appreciate all of the support that we've received over the years. But at this point, we are facing some unprecedented challenges due to reduced funding, diminished grant dollars, delayed distribution of these grants, and these financial constraints, they severely are impacting our sustainability and the capacity to offer the essential services that are needed. Just as reported by Zeph, the needs are not reducing, the needs are increasing in so many different areas. And so as we're struggling to meet the needs of the community and make sure that we're identifying the new needs, we're identifying our performance and measuring the outcomes to ensure that we're moving in a positive direction, the funds are really needed more than ever. Overall, the community needs, as they're escalating, our ability to respond effectively is becoming increasingly compromised, which affects the lives of those people who have really grown to depend on our services. While we continue to extend our support, whenever possible, we'll continue to do that. We just want to remind you that the evolving environment creates growing concerns for sustainability of programs like ours that are really doing the grassroots work that is important to Lucas County. So I know that I met with the executive team this morning, and we've been talking about this over the last couple of weeks. Although we can't readily identify an area where a cut would not impact the person served, we are open to seeking continued conversation and having continued understanding, and we hope that collaboratively we can address these financial challenges in a manner that ensures we have the availability to provide ongoing services to this critical population. So I just want to thank you for your attention, your consideration, and your continued support during these challenging times. The board's role is just vital in sustaining the health and well-being of our community, and we appreciate you more than you know, and we understand the challenges that we are facing, and we look forward to helping alleviate the issue.
Thank you.
Thanks, Tava. appreciate
You're
your
welcome.
comments. Any response, any question? All right, we appreciate it. Tell Janice we said hello.
Oh, she's watching.
Well, then I'll say hi, Janice. Okay, our next speaker is Miss Annie Minton. Annie is our newest Behavioral Health Criminal Justice Coordinator. She works for the Criminal Justice Coordinating Council. Annie?
Yeah. Hi everyone, thank you for allowing me to speak today. As Scott just said, my name is Annie Minton and I am the Behavioral Health Criminal Justice Coordinator at the CJCC, which is the Criminal Justice Coordinating Council for those of you who aren't familiar with us. So today I would like to take this opportunity to ask the board to continue collaborating with the criminal justice system to develop a system that deflects individuals with behavioral health needs away from the criminal justice system. So every week I participate in the population review team, and through this team we review the pretrial population at the Lucas County Corrections Center to recommend expedited case resolution and bond revisions. And if there is one thing that is clear when reviewing this population every week, it is that this population is in need of behavioral health interventions. And for this reason, I cannot express how glad we are that the MHRSB is pursuing the levy, which will lead to behavioral health interventions for this population. But until the levy is passed, in the meantime, in order to ensure that we are doing all that we can to improve outcomes for individuals, reduce inappropriate incarceration, increase access to services, and enhance public safety, I recommend the MHRSB continue to support the work of the Data-Driven Justice Initiative. It's now formally known as the Familiar Faces Initiative by the National Association of Counties. We know that individuals who are frequent flyers or familiar faces, as we call them, at the Lucas County Correction Centers are also high utilizers of other community resources. However, despite this high utilization of services, these individuals do not access adequate care for the challenges that they face. The Data-Driven Justice Initiative is an opportunity to look at this population of high utilizers and identify interventions that stop this revolving door, as we call it, of incarceration and actually address the underlying challenges faced by this population. I would like to encourage, and I will say, one of the biggest barriers faced by this population is chronic homelessness. I would like to encourage the board to continue working within our community and partnering with agencies that are working hard to end chronic homelessness. Doing so will not only interrupt the cycle of incarceration for criminal justice system's frequent utilizers, but also make our community stronger and safer. Finally, I want to thank the board for their investment in the CJCC by funding my position, the Behavioral Health Criminal Justice Coordinator. I believe continued funding for this position will allow the board to continue to collaborate with the criminal justice system and create system-level change at the intersection of the behavioral health and criminal justice systems. If there's one thing I've learned from working in Lucas County, it's how important collaboration is and how well we do it. Thanks.
Thanks, Annie. Any comments? Thank you. Our next speaker is Mariah Cornoa. She is the newly hired Executive Director of Toledo NAMI and the board chair of the Lucas County Suicide Prevention Coalition. Is that correct?
That's correct.
Go ahead,
Correct.
Mariah.
Hi, everybody. Thank you so much. I have really an introduction, a quick update, and then a call to action. So first, I am the board chair for Lucas County Suicide Prevention Coalition, and I wanted to speak on that in terms of where we've been in the last year of a reboot post the pandemic. And I'm really proud to say we have consistent evening participation every month. We have a coalition that is empowered to do the work. They're leaving every month with their prevention to go work. And I'm really excited to announce that we are moving forward. We're hiring some coordinators to support this work. So things are happening there. One of the things I'm really proud of in the last year is our approach to our cultural humility trainings. We've put a lot of support behind NAMI's African American Leadership Initiative, their Latinx forum they do, and there's more to come around that. We also did an empathy training for the LGBTQ+ community, and really working to align with NAMI and the treatment providers. That's what I've been doing for the last year under suicide prevention. Now I've also had the opportunity to be the new executive director at NAMI. And the first thing, just as a reminder, we do support, education, and advocacy, and all of that is free. One of the important stipulations I'd like to make is that free doesn't mean less value, right? That support is that intermediary support or that thing that we can plug in between appointments. That support is really what brings a shared humanity, and I'm really excited to see where that goes. I'm also happy to report that we're working to align with NAMI Ohio and NAMI National, and that looks like their policy work around early intervention, best possible care, which to me means trauma-informed care, cultural humility, and a criminal justice diversion. What NAMI Toledo and what I plan on working on for the next 6 months really is stakeholders, figuring out what the mental health priorities are around town, how we work together collaboratively to fill these gaps, and a big component of that, because as you heard, and thank you, Adam? Yes, really well said, and the same things we're facing is, you know, rising operating costs. It's the first thing I'm looking at is funding. Retention issues and how we protect that workplace wellness space. So a big thing that I'd like to approach moving forward is the responsibility of our employers around workplace wellness and what that looks like. A big issue is a lack of EAP utilization and all of that starting in-house with our own people. I want to really call attention to some of the great work that is happening in Toledo around the Middle Eastern, Northern African outreach that our behavioral health navigator is doing. There is a huge demand increasing with these specialty populations that we need to give attention to. So, in closing, I just want to skip over my part about what workplace wellness means to all of us. But from a call to action, I do need to just say that our concerns are around that limited staff capacity, retention worries, the misconception around NAMI being associated with poverty. Mental health is for all of us, right? And so also, even within the mental health system, a lack of awareness around NAMI services. We're finding that people just aren't familiar enough. Our technology and cybersecurity risks with the type of content that we're coming in contact with, again, paying attention to that as a system, and how we treat peer supports, and how we fund that as well as political divides and bipartisanship. I'm going to throw that out there. So the call to action is really, please reach out. I would love to get your feedback as we plan for, but seriously, your time is up. I'm on there. I'm doing two committee updates here. Please consider us for future partner alignment. Let us know how we can support you and give us grace during this transition.
Just so you know, that's an unsanctioned sign. We just gave you that sign, didn't we?
Turn around for the next board meeting.
We have two more speakers. We're going to take our in-house speaker first. Miss Raina Dawson from Able is here.
Hi.
And then Corey or Miss Shaw, you'll be next.
Okay, I'm going to be very brief. My name is Raina Dawson, attorney at law. I'm an attorney at Able, Legal Aid sister law firm or nonprofit law firm. You can think of us as like the civil public defender's office. So we serve our community in a very impactful way. And we cannot do our jobs without the Mental Health Recovery Services Board of Lucas County. You all are our, lifeline. I'm in a housing group at a healthcare and public benefits practice group. So I kind of split myself in half and work in those ways. So I will turn in my meaningful comments in writing because right now I do not have comments and I do not want to say anything that is not meaningful and intentional. So thank you so very much. I'll turn in my comments tomorrow morning.
Thank you. And it's always great to put a face with a name, with a program. So we appreciate you making the effort to be here on such a cold day. Actually, all of you. Speaking of cold days, though, we have a special guest from Court Diagnostic and Treatment Center, Miss Megan Shaw virtually. And Megan, correct me if I'm wrong, clinical director for the Court Diagnostic and Treatment Center and trained forensic psychologist. Megan.
Hi, I hope everybody can hear me. I apologize for no video today. I wasn't expecting to speak. I also have never attended one of these forums before, so I'm excited to speak with you. And I hope at some point that I could meet all of you in person. Scott, I have met you in person as before, but with all of you as well, I would enjoy that. So I am the Forensic Director of Court Diagnostic and Treatment Center. Renee Palacios is our Executive Director, and I wanted to represent CDTC on behalf of our agency. And, you know, CDTC at this point, I've been in my role for almost 2 years now, and I primarily head up the Forensic Evaluation Program for Court Diagnostic and Treatment Center. We provide criminal and civil evaluations for 13 counties. Lucas County is our largest county that we serve. So we provide several different types of criminal and civil evaluations for kiddos, for adults, and so we run the gamut of that. I also am in charge of the adult outpatient competency restoration program for adults found incompetent to stand trial. And that is a relatively new program, and we're still in the process of kind of finding our bearings and serving that population as well. So CDTC also has a treatment department that provides court-ordered treatment for you know, essentially anybody that needs mental health treatment that is involved with the court at any stage of the process. Primarily happens at post-adjudication and post-sentencing. They provide specialized services for sexual deviants. They provide specialized services for domestic batterers and anger management as well. So, and I know that the treatment department is hoping to expand that as well and reach out to other parts of the community. So I hope that that provided a little bit of information. I know that historically CDTC, my understanding, has not been ever present. So if anybody would like to have more information about the services that we provide, do not hesitate to reach out to us. We have a new website that will be going live in a couple of weeks. So hopefully you'll enjoy our new branding and advertising. We've worked really hard on that, as well as you know, a new referral process as well. So thank you for listening, and thank you for the opportunity to attend.
Thank you, Megan. Any comments? So I tell you, I'm going to make one. As if you could stop me. But we've heard a couple of things today, but probably none more present than this idea of criminal justice. And that kind of was weaved through almost all of the comments and impact all of our providers. You know, Ms. Shaw made some comments around competency evaluations. Senate Bill 2, sorry, I'm off camera. Senate Bill 2, outpatient competency, has kind of really put a wrinkle in our system that we haven't quite caught up to yet. We're finding that individuals that are those frequent flyers, those high utilizers, and those that are most in need of services are becoming more difficult to engage in services, get access to hospitalization, get access to housing, And unfortunately, what happens is then they languish in our jail in many cases. That creates issues not only for our jail and safety issues for our jail staff, but for the people that are our patients. That flows down to Zeph Center then, who has to go back and evaluate them time and again to try and get them into a state hospital setting. And it has this ripple effect across our entire system. And so as we think about what our safety net should be doing, it really is protecting that group of individuals and trying to figure out what is the best solution to support those individuals. And I don't know if I don't think I really need to tell many of you that, just simply because some of you have lived it. And so you know the difficulty in trying to engage the system when hospitalization is no longer accessible, difficulty gaining access to treatment, or if treatment is available, maybe it's not at the level of which you might need. And so places like Danny's Place and the redesign of our our crisis services, and support from Court Diagnostic and the way they're transforming their business model is helping, but we're still not there yet. And so, the continued advocacy, and I'm going to tie this back to our levy, and the goal to fill out our criminal justice continuum with quality treatment services in the jail will go a long way to jump-starting everything else that is downstream from that. Of course, first and foremost, we always want to keep people out of jail and provide them quality behavioral health services in the community. But when accountability requires a stay in our local detention facilities, that doesn't mean you should be without treatment, and we want to do that too, and that's paramount to what our levy can do for us. So with that, I'm going to close out the session. If Pastor, as chair, you want to make a few comments, or if anybody wants to create some observations, please feel free.
I do want to make a comment. Every agency talked about collaboration. The need is desperate. There are more people being referred. There are more people that need services. They want to provide the best service they can, and they want the system to help all the clients. That's across the board. And so I thank you for talking today and letting us hear you. I appreciate it.
I want to say this was a necessary process. I thank all the presenters who came and presented. We heard, and we thank you for your presentation. I do want to mention the services that we will provide. The levy hopefully will allow us to provide for mental health services for the jail. I think that it's extremely necessary, as presented here and as you heard tonight. The board is very much interested in going forward with that in a way that enhances our community. And so many people have suffered and gone through so much that we can make a difference in their lives. And I think that all of us here are committed to transforming the lives of those who are suffering under mental duress. So thank you for your support, and we did hear you. Thank you, Scott.
We do have one other person that would like to just kind of supplement her comments.
Real quick, I wanted to add, on the line of competency evaluations, the CJCC, I'd like to really thank Megan Shaw and Renee Palacios from CDTC, as they've really been instrumental in this process. But we're actually doing a system-wide evaluation of the competency to stand trial process. We're hoping to map out the system and identify opportunities for enhancement with subject matter experts, Dr. Kathleen Kemp and Dr. Christy Giolella. So there is hope, I think, with the competency to stand trial process. We're hoping to have recommendations and work with best practices using the data that we do have. So I'm sure Scott will be involved in this work, and we'll hopefully have some updates for you too on that continuum later.
I already scheduled my appointment with Dr.
Perfect.
Yes, Raina?
I'd like to add something else, but I still want to answer the question specifically about the $950,000 in writing. But I have something else to add. At ABLE, we do more legislative work than LAWO does. Most recently, we are supporting legislation that would allow for fines that are attached to traffic citations to be eliminated, so more people can return back to driving and be licensed drivers, be insured drivers, and keep us all safe. I posted a couple of driver's license reinstatement clinics, and they are overwhelmingly attended, and that involves having courts from Sylvania, judges and clerks from Sylvania, Toledo, Oregon, municipal courts physically present, the B&B physically present, and insurance salespersons physically present and being there, and they're a huge deal. It's an overwhelming issue. We also are supporting legislation around immigration and healthcare. It's an area I didn't know that would intertwine so intimately, but there are issues by which we have citizens that live in this area right now that would not be able to pass a citizenship test based on their mental and physical health. So those are some of the things that we're working on, and at least we can maybe collaborate in the future.
It was nice that our local newspaper gave you an op-ed on that issue relative to fees.
They did? Yeah.
All right, with that, while we had a smaller than expected group commenting today, it certainly was mighty and full of information that we needed to hear. So we appreciate you all. Thank you for coming. Thank you for your comments. And we'll close that out. Thank you very much, folks.
Thank you.